Okay, so I think we'll go ahead and get started. Thank you for the introductions. And so what Kelsey and I are going to be talking about today are policies, resources, and strategies identified for hopefully for social workers to reduce the burden of firearm injuries. And this work was done by Kelsey and the team at the Firearm Injury and Policy Research Program, which is housed within the Harborview Injury Prevention and Research Center, where both Kelsey and I work and have appointments. And so I think I just want to say that Kelsey's really done the formative work in the country on the reduction of firearm injuries and the use of some of the tools that we're going to be talking about, and really linking that to social work practice. And so we're excited to share what we've done so far, but we're also really interested in your thoughts and feedback or ideas or questions as they arise, because this is all kind of new things and things that we are that are still it's iterative process of development. We want to acknowledge our funding from Washington State and our collaborators and partners in this. So we'll focus on sharing some new and existing policy options to facilitate temporary firearm removal when somebody is in a crisis. And then we will talk about some resources to understand those options that are available for you. And then, like I said, from our end, we're also really interested in your questions, ideas, feedback as these policies are, rolling out and are being used more and more. Go ahead, Kelsey. We'll talk about 3 tools that we think might be useful in the toolbox of a social worker working with patients and clients in the field. A voluntary waiver of firearm rights, what's kind of commonly called the do not sell list. Safe storage map, and that's a map of locations where people who would like to voluntarily surrender their firearm if they're not feeling safe, places that will accept those firearms and hold them. And then a policy called the Extreme Risk Protection Orders, or ERPO. And we'll talk about some of the research that Kelsey's done in that area, and also some ideas for things moving forward with those protection orders. The feedback specifically that we'd be interested from you is, how do you think you might use these in your practice? And Kelsey's going to go through all of them. What are we missing? What aren't we thinking about? What do you see on the ground that we should really take into account as we're moving forward with these policies? And what additional information would be useful for you so that we can move forward with potentially developing some trainings, maybe in collaboration with some of you who are interested in this and working on helping people stay safe, especially when they have a firearm. Okay, go ahead, Kelsey. Thank you.
Great, thanks. So I want to start out today by talking kind of briefly about the overall burden of firearm injuries and the logic behind why some of these interventions were developed. So the US is seeing about 40,000 firearm deaths annually, and that's kind of been increasing. About 60% of those occur from suicide. And attempts to die by suicide with a firearm have about a 90% fatality rate. So one of the most effective methods to reduce firearm deaths is lethal means restriction, or reducing access to the most lethal method of harm, in this case, a firearm. Lethal means restriction, this can allow for a crisis moment like a suicidal crisis, which can often, that suicidal impulse can often be very brief. So these kinds of interventions allow that brief moment to pass and for an individual to receive supportive interventions like counseling or other supports. So the idea behind the policies that I'll talk about today is based in all of the research that we have showing that lethal means restrictions for firearms can reduce suicide by firearms at both a policy and the individual level. So this brings us to the question of social workers' role in the ERPO process. In our research, we've seen that social workers can be really critical to addressing firearm-related harm because they often serve clients at elevated risk for firearm fatalities, like those experiencing suicidal ideations. But we're also really curious about your thoughts about how you do or don't want to be involved in this kind of work. So our thinking is that social workers have experience assessing and intervening to reduce the risk of harm, and that they often have this really unique understanding of how these contextual life factors can influence the risk of harm. Lately, we've also been thinking about, this is kind of a newer area of research, but we've been thinking about the role that social workers could also have in supporting clients after they've gone through this temporary removal process, whether that's voluntary or involuntary. But once they've kind of completed that process and have their firearms returned, that social workers could potentially have a role in continuing to evaluate the risk, their level of risk, and supporting them as they're kind of transitioning to the next stage. The first policy I'll talk about today is the voluntary waiver of firearm rights. As Megan said, this is also known more informally as the voluntary do not sell law. So this law exists in some form in only 3 states, Washington, Virginia, and Utah. And Washington's actually the only state in the country that has all 3 of the interventions that we'll talk about today. In Washington state, the way this process works is that someone who is concerned about suicidal thoughts can voluntarily ask to be put on this do not sell list. And this list is used during the background check process when someone's trying to purchase a firearm. So this request is fully reversible. It can happen in consultation with care providers like social workers or physicians. And the goal is really just to reduce suicide risk by voluntarily restricting immediate access to firearm purchase. So as you're all aware, many suicide attempts are impulsive. They're usually warning signs that individuals can notice with support. And so because suicide attempts using firearms are nearly almost always lethal with no real second chance to get help, this do not sell law allows folks to add this extra layer of protection against firearm purchasing. But then the other thing that's really neat about this law is that it also really prioritizes confidentiality and privacy for folks who decide to place themselves on it. So just a little bit about how this process works. The first thing that happens is an individual contacts their county clerk's office. And I've got links throughout this presentation. We'll send those out after to anyone who's interested. So an individual would contact their county clerk's office. I think because of COVID, this process can now happen virtually. You have to go in person, but now I think there's a virtual option for most counties. And they'll file this voluntary waiver of firearm rights. The clerk will then enter the information into the national database that indicates this person shouldn't be sold a firearm. So if they go into some kind of firearm retailer, try to purchase a firearm, it's required that that person run a background check. And so this would pop up saying this person shouldn't be sold a firearm. After about a week, the individual can remove their name at the same county clerk's office. And at that point, in order to prioritize confidentiality and privacy, all the documentation is destroyed. In Washington, this law hasn't been used much, so we really don't have any research on whether or not it's effective yet. But that's also why we're excited to talk to you today about this and see how, or even if you can see yourself talking to your clients about this option. The next intervention I'll tell you about today is a tool that can help your clients find a place outside of their household to store firearms. So the do not sell law kind of prevents purchasing of new firearms. This kind of solves the problem. Well, what do I do with the firearms that I do have currently? So similar to the do not sell list, the goal is just to reduce availability and immediate access to the most lethal means in a crisis moment. A version of this law exists in just a few states, Washington, Colorado, New Jersey, Maryland, and then some parts of New York, but not the whole state. So the Washington Firearm Safe Storage Map shows gun shops, shooting ranges, police stations, where you can temporarily store firearms outside of your home. A few process things, it's recommended to call ahead to get the details on the process for storing, because some things can vary place to place. Some locations charge a really small fee, and you'd also want to ask whether a background check will be conducted when firearms are returned, and then any time limits on like the length of time that firearms can be stored. Some places also have pickup services, which is cool. So this is what the map looks like when you click on this link. And again, we'll send links out to all these resources. So the way this was made here in Washington is that we had someone from our research group call every law enforcement office firearm retailer and shooting range that we could get our hands on a phone number for. And so they asked the manager or the owner questions about whether they'd offer temporary storage for firearms, what policies they might have around that. And so the agencies and the retailers that you see here are the ones who agreed to be on this public list. But we also heard from many other retailers that they wouldn't feel super comfortable being on a public list, but that they would definitely consider offering storage on a case-by-case basis. So especially if you have a client who's already connected with the group, you can encourage them to reach out to that group that they're already connected with, even if they're not on this list specifically. The last policy intervention I'll talk about today is ERPOs. We have a lot of research on ERPOs, so I'll talk about that as well. And that's why we'll spend the most of our time on ERPOs. So ERPOs are a civil order, meaning there's no criminal record involved. And these can be filed for individuals who we call respondents who engage in behaviors indicating that they're at substantial risk of harming themselves or others. So that's one thing that's really important about the law, is that it's focused on this kind of behavior versus some kind of like mental illness or mental health diagnosis. It's really focused on these behaviors that are indicating risk. So one thing that distinguishes ERPOs from the other two options we talked about today, the do not sell list and the safe storage map, is that those two options were very much voluntary and they're client driven. ERPOs are typically, though not always, but they're typically filed for someone who isn't open to voluntary removal. But because the ERPO process is involving involuntary removal, there's a lot of protections in place to be sure that this is an appropriate option for someone and that their rights aren't being violated. So the goal behind ERPOs is, again, just to temporarily restrict firearm access for folks. So this will mandate both removal of any firearms that they presently possess, and it will flag them in any background check. So it's kind of addressing both firearms that are presently owned and reducing their ability to access, purchase new firearms. Here in Washington, the law was passed, the ERPO law was passed in December 2016. We have information of ERPOs up to September 2020. We're still collecting data for the rest of the time. But between that time period, there were 505 ERPOs filed. But at the county level, usage is varying greatly. King County, probably unsurprisingly, has many ERPOs filed. But there are actually 12 of the 39 counties in Washington that don't have any ERPOs filed. So again, this is why we're excited to talk to you all about this today. So here's a map of where ERPO laws exist and kind of the differences in who can file ERPOs. So ERPOs exist in some form in these 19 states and Washington, D.C., although what they are referred to differs. So in California, they're called gun violence restrictive orders. But here in Washington, I think in most states, they're ERPOs. So law enforcement officers can file everywhere, all 19 states and DC. 10 states also allow a family or a household member to petition. Only Maryland, Hawaii, and Washington, D.C. allow for a health professional, which would include social workers, to file an ERPO themselves. So in Washington State, law enforcement officers, family, and household members can file. And I'll talk in just a little bit about how ERPOs could still be relevant to your practice, even though you can't independently file for a client here in Washington. But first, I want to briefly walk you through Washington State's ERPO process, just so you have an idea of how this process works. So it generally begins when an individual, such as a family member or a law enforcement officer, or in some cases even a health professional like a therapist, mental health provider, witnesses some kind of potentially dangerous behavior, often in a crisis moment that indicates that someone is at substantial and imminent risk of harming themselves or someone else. So the witness can file a petition with the court if they're eligible. If they're not eligible, they can contact law enforcement who would file it, or in cases of like a respondent's established mental health provider, if they had permission to contact a family member or a caregiver, they could have that person file it as well. So what's in the petition is that it just kind of details the reasons for filing. A lot of times it's accompanied by addenda if there are police or jail or incident reports. We've also seen affidavits written by mental health providers, is just kind of establishing why this person's at substantial and imminent risk for harming themselves or someone else, and the ways in which they would potentially benefit from an IRPO. So a judge then reviews these documents and will determine if a temporary, or also known as an ex parte order, should be issued. If they do determine that that temporary order is warranted or is not warranted, then they can deny it or dismiss it. If at any time firearms were confiscated, so a lot of times police will kind of respond to an incident, they'll confiscate firearms and then file the IRPO. So if that happened and those firearms were confiscated, they're returned and all documentation is destroyed at that point. If the temporary order is issued, law enforcement will then seek to remove any firearms that the respondent was currently possessing, and then they would place them on a list prohibiting firearm purchase. And again, if that's granted, then within 14 days, a follow-up hearing will be scheduled. And at that point, the judge will determine if a one-year order is warranted. That can be granted, and then there's an opportunity a year later to have that renewed again. Or typically, if once it's granted, that one-year order it kind of expires unless there's been some kind of change in circumstances. Or the judge can deny or dismiss the order. And in that case, any confiscated firearms would be returned at that point. So now I want to talk a little bit more about research on IRPOs. 17 of the 19 states in DC that have IRPO laws have actually passed that IRPO law since 2016. So that really limits the research that we've been able to conduct. But we do have some preliminary evidence and then some more robust evidence in 2 states that have had this law for a couple of decades now. So we've seen that they can be potentially promising intervention to produce both mass shootings and suicide. There's a case study of California's IRPO law, and they found at least 21 cases over a couple-year period where IRPOs were used to remove a firearm from someone who threatened a mass shooting. Connecticut and Indiana were the first states to pass IRPO laws in the late 90s. And so those evaluations of those laws have shown that they are really effective in reducing suicide. On average, they found that there is 1 suicide prevented for every 10 to 20 firearms removed through IRPOs. So now that I've talked about the effectiveness of IRPOs overall, I want to talk about a kind of different approach that our research group took. So this model comes from an article that was just published from our group. We wanted to try to understand the context that led to IRPO filing. And so what we did is we actually qualitatively analyzed the text of IRPO petitions filed in Washington. We looked at about 230 IRPOs filed in Washington, the first 230 IRPOs filed. And so this model might look familiar. We found that it was the process that was kind of leading to these crisis moments that were leading to IRPO filing, really aligned with the social ecological model that we often learn about in our theory courses. So we kind of decided to visualize it that way. So specifically, we found there were these kind of compounding factors that led to the crisis moment that created the need for an IRPO. So at the societal level up here, we saw respondents describing racism and discrimination that was influencing their crises. We also found these structural challenges like unstable housing, issues with employment, financial strain. They were also influenced by these really critical gaps in legal and healthcare systems, as well as interpersonal stressors coming from strained relationships or major life events, such as like death of a loved one. These all together were kind of creating these compounding stressors that were influencing health and individual behaviors like mental health issues, substance use issues, and these kind of all culminated in a crisis moment that led to the need for an IRPO. So the results of this study got us thinking about the role social workers could potentially play in identifying folks who could benefit from IRPOs, because as we talked about earlier, social workers have so much experience assessing clients for risks, but assessing clients for risk within this really complicated context of their lives. So this brought us to our next phase of research, and this is where most of my research is around specifically the role of social workers in IRPOs. So at the national level, this idea that health professionals and social workers could have this unique understanding of contextual factors in respondents' lives, there have been calls for them to be included as independent IRPO petitioners. So instead of having to contact a family member or law enforcement, they could just file themselves. But we felt that it was actually important to understand the process of their involvement with IRPOs when they couldn't independently file, because that's actually the case for most states. And then furthermore, as I'll talk about later, do they even want to be independent filers, or would they actually prefer to be going through these other different options? So in this next study, we reviewed the 24 IRPO petitions filed in Washington state where there was a healthcare or mental health or social work professional who contacted an IRPO petitioner, like a law enforcement officer or a family member. So we just kind of wanted to understand, what does that process look like, and how does that process where these health professionals are involved differ from IRPOs that are just going straight through law enforcement without someone, some kind of health professional involved. So the previous research up until this study that had been done on professionals' roles in IRPOs only looked at physicians, and specifically only looked at physicians in Maryland. So our study illuminated this kind of similar or even enhanced role that other professionals like social workers could play in the IRPO petitioning process. We found that this role was very different from law enforcement's role when we kind of compared, in some cases, like the affidavits that would be provided by health professionals to the way that law enforcement was kind of writing about the circumstances. And the ways that this was different is the process by which they conducted a risk assessment. And this process was different because they just had more access to and knowledge about the factors that were contributing to an individual's risk. And they were also interpreting and responding to client behaviors really differently than law enforcement. In particular, because respondents' established mental health providers had the most access to risk and protective factors, they were also most often able to evaluate risk in person, which we could see was kind of changing the way that the respondent was responding to this health professional in the crisis moment. We were really seeing that including these professionals could be really helpful. But what we wanted to do was, now that we kind of understood how social workers were involved in early IRPOs, we wanted more information on their preferences for involvement. So how do they want to be involved? What are their concerns for involvement? And what are kind of the barriers and facilitators? So many of you likely received this survey about 6 months ago. That's how we got connected to this group. We really wanted to understand their perspectives on the 3 ways that we could see them being involved from our prior research. And so the ways that we could see them potentially being involved would be counseling a client's family member about filing an IRPO, of course, with the understanding that in this case, they would have permission to talk to that family member or caregiver. Contacting law enforcement and kind of supporting law enforcement as they filed the IRPO. And also independently filing. So the only research that had been conducted up until this point on independent filing, health professionals independent filing, were in states where that was already legal. And so we wanted to see, in a state where that's not actually legal, would folks actually even want this option, or would they prefer to kind of not be independent filers and go through one of these other venues? So I'll go through the results of this study. So one of the first things we asked about was just about how often the social workers who took our survey even saw clients who might benefit from an IRPO. In purple here, you'll see how often participants saw clients at risk of harming themselves. And then in gold, you'll see about how often they saw clients at risk of harming others. We had about 1,300 social workers respond to the survey, and most of them encountered a client they believe to be at substantial risk of harming themselves at least monthly, and substantial risk of harming others at least a few times a year. So this suggested to us that this could be a good professional group to kind of target for these kinds of interventions. So the next thing we asked about was about whether they'd be willing to counsel a client's family member, contact law enforcement about an IRPO, or independently file an IRPO. And again, you'll see questions about clients at risk of harming themselves in purple and at risk of harming others in gold. We found the overwhelming majority of social workers were willing to engage with IRPOs in some way. 96% were willing to counsel a client's family member. And we also saw that this willingness didn't differ according to whether clients were at risk of harming themselves versus others. But the results were also clear that social workers were more comfortable counseling about IRPOs than working with law enforcement and independently filing. So now I'll talk a little bit about the things that kind of made this willingness different across categories. So in terms of barriers, we found a lack of knowledge about the IRPO process was associated with all of these methods of engagement, willingness to counsel, working with law enforcement, independently filing. Participants were concerned about involving the court and legal system or law enforcement across all three engagement options. Folks were understandably concerned that working with law enforcement would affect their relationship with their clients. We also had an option on the survey. We felt we could definitely see that this would likely be a result. And so we wanted to give people the opportunity to really elaborate and give more detail on the reasons behind their concerns about working with law enforcement and involving the court and legal system. We are still analyzing those results, so I don't have them for you today, but they are coming soon. But we'd also love to open that up for a discussion today. One of the major facilitators suggested by participants was just the ability to access experts in IRPOs. So they said things that would help their willingness to engage in IRPOs. And one of those three ways would be if there were legal experts they could consult with, an IRPO coordinator or a liaison within their practice setting, or even at the city level that they could refer clients to. And then also the overwhelming majority of participants also expressed interest in a training for social workers specific to what IRPOs are, the process of IRPO filing, and how to talk to clients about IRPOs. So that kind of wraps up everything on IRPOs, but this brings us to our next steps for this research. So we're hoping to develop trainings and educational materials that are specific to social workers, not just about IRPOs, but about all the intervention options that are available to kind of help them address the risk of firearm injury in their clients. So some of these materials exist, or some version of these materials exist for other disciplines like physicians, but from our work, we're really seeing that social workers could potentially have a different role, but one that makes social workers kind of uniquely well positioned to intervene with this understanding of the contextual factors in folks' lives. But with that said, we also want to make sure that anything we develop actually resonates with what you want your role to be in firearm injury prevention. And we want to make sure that it's actually useful. So definitely stay tuned. We will be recruiting soon for compensated interviews and focus groups to help us develop and then eventually test these materials. The last thing that I want to show you is kind of, now that I've talked about the policy options, we have a couple of resources that we'll send out. So our group developed this toolkit that covers all three of the interventions we talked about today: the firearm safe storage map, the voluntary waiver of firearm rights, or the do not sell list, and IRPOs. And so what's included in these resources, it's a website, and they have videos on IRPOs, the do not sell list, and safe storage map. And these are really accessible and appropriate for all audiences. We also have downloadable flyers for each intervention available in both Spanish and English. And so these would be appropriate to give to clients. There's also a toolkit tailored specifically to health professionals, including social workers, that talks more about how you could potentially use these interventions in your practice. And then we have links to other resources at the state and national level. All right, so Megan, do you want to bring it back? I know we've gained lots of folks since you first introduced this feedback. So if you, I'll turn it back over to you.
Yeah, thank you, Kelsey, for that overview of these policies and interventions. Yeah, so we really, wanted to share these resources with you because, as we've learned from talking with social workers across the state, these are not as well known of policies or interventions. And so we're excited to talk to you and sort of hear about how do you think you might use these, or if you do use these in your practice, what you think about them, and thinking about, based on kind of what Kelsey presented, what's missing or how you think about your role and other things that we should be thinking about. And obviously this is just the beginning of the conversation. We're hoping to follow up with many of you after this presentation. And then also in thinking about training, as Kelsey mentioned, what additional information would be useful or helpful in thinking about using these in your practice. So that's, yeah. Love your questions or.
It looks like Katie has her hand raised.
Katie, sure, thanks.
Hi, can you hear me? Okay, good. My name is Katie. I'm a social worker and I work at hospice actually. And this is actually a very timely presentation. Thank you, because we actually just did a suicidal intervention kind of in service and talked about ERPO. And in doing some research, because we really just heard about this not long ago, there were some questions that kind of popped up that I'm hoping maybe you have some clarification to. We have developed a partnership with our local, Volunteers of America, VOA, and our local DCR team in Skagit County. And in kind of exploring some of these issues, it came to our attention that the HB 1310 bill that just passed last year limits the use of force greatly by police, which, has its benefits for a lot of reasons. But one of the challenges and the barriers is their ability to actually engage in the community when it comes to not only helping people in crisis, but also their inability to actually confiscate firearms, the ability to encourage them to turn them in, but not necessarily to confiscate. So I'm wondering about that barrier, if you can speak to that. And then also in the same realm, would the DCR and Volunteers of America, could they be considered, what you're referring to as kind of the legal experts for consults, or are there other suggestions for who those folks could be in these situations?
Kelsey, do you want to? You're muted.
Goodness, I pushed the button so many times. Yeah, so in terms of the use of force bill, I think, none of these policies are perfect. I think the idea behind having them all is kind of we're attacking the problem from so many different angles. But in terms of ERPOs, I think one of the noted weaknesses across the board is in this fact that law enforcement has to be able, in order to remove access to firearms, law enforcement has to be involved. So for folks who are in general concerned about involvement of law enforcement, that can be a concern because there's really, if someone already has access to firearms, there's really no way to facilitate that removal without getting law enforcement involved. But also there is, a weakness in this law that we can't guarantee that we've removed all the firearms from someone. Even after law enforcement's confiscated, like we can't guarantee that those are all of the firearms that person has access to. So I think it is a weakness in the law and something that has to be considered with that bill. I don't have a clear-cut answer for how that can be addressed, but I think it is just kind of one of the weaknesses, and I think that's the benefit to having so many different versions of these different policies so that we can hopefully find something that's appropriate for everyone.
Absolutely, thank you. And I want to clarify, I'm sorry if my question wasn't clear, but the limitation to removal is extended to law enforcement in our area from what we're seeing. So, of course, even if we do get them involved, there is still the barrier of actually confiscating them, even if the law enforcement are the ones trying to implement it.
Yeah, definitely. And I think that's just at this point, that's just one of the weaknesses of the law. And I don't know that we have a clear-cut answer of how to address that. Of course, this law about trying to reduce lethal force makes perfect sense, but it does cause these kind of other issues that I don't think have been addressed yet, at least not in the work that I've seen. Megan, do you have any response to the question? I'm not super familiar with the Volunteers of America. The DCR we did see involved in a couple of the ERPOs. It didn't seem, at least from, I've kind of only seen come at this so far from being able to read the actual petitions. And it did seem that there was a little bit of confusion. And this was also in the early days. So the ERPO petitions I was looking at was in like 2017, 2018. At that point, it didn't seem like DCR had the most robust understanding of how to kind of use these ERPOs, but that definitely could have changed in the, how 4 or 5 years since since I was kind of looking at those initial ones.
Yeah, and I'll say, the reason we found out about ERPO in general was actually through Adult Protective Services, which was a wonderful resource. So I don't even know if our DCRs are super familiar with them, with the ERPO either.
Yeah, we have a colleague, Laura Prater, who does research on ERPOs and other kind of firearm removal options specific to older adults and also folks with dementia. And I know she's also done a little bit with Adult Protective Services as well. So I think we're still kind of getting the word out there, but also still kind of understanding how can all of these different tools be used by clinicians specifically.
Thank you. And I guess, sorry, I guess I'm full of questions. My follow-up to that would be that, is there any way that you know of legislatively for people to get involved in kind of advocating for ERPO and what the ramifications are and, in response to HB 1310 and, the barriers to what that causes?
Yeah, so there is, it's actually situated in the Domestic Violence Resource Center here in King County, that they also have ERPO experts, and they are considered ERPO experts nationally. They get contacted like nationally to help kind of work through legislative options, also deal with things on an individual case-by-case basis. So when we send out this list of resources, I'll list their contact information. And they are Sandra Shanahan, fantastic. Kim Wyatt does a lot of the prosecution for ERPOs. So I can send out their office's contact information and they would definitely have the answers to that.
Thank you. That'd be great.
Thanks for your questions, Katie. Good question.
That was great. Yeah.
I had one person message me asking about how they can get these policies implemented in their state.
So I think that the ERPO office I was talking about and Sandra are definitely experts in that. There's also, we can send out links to Hopkins has an ERPO website that is very well maintained. It has the details and characteristics of the laws in every single state. And it also has, I think, some tracks of like failed attempts to get an ERPO law through. So I can also send out that link as well. I know there was also a report commissioned, and I don't think it's been published yet, but President Biden commissioned a report to kind of create a model ERPO law. So I don't think that's been published yet, but it should be coming out. And the goal of that was to kind of have this model law that states could just implement. One of the core issues that we were concerned about, and I don't quite know where the committee landed on this, was some folks. So Maryland specifically is a huge proponent of having clinicians be independent filers. But we just don't have a lot of research on whether folks actually want that to be an option or what are kind of the limitations around that. There's very, very limited research. So I'm also curious to see kind of where the committee landed on that, but that policy does, or that report should be coming out very soon. I will double check that it hasn't been published. And if it has, I'll definitely send that link as well.
Thank you. I have another person messaging me asking about if you can speak a little bit more to about how they can get their organizations to regularly offer these trainings or get them to the DOH, for them to be able also to get DOH to provide these trainings.
So trainings in terms of like what we were talking about today, or the trainings that we would potentially develop?
What you're chatting about today.
Yeah, so we're happy if anyone wants to reach out, we'll of course send out contact information. We're happy to give whatever version of this talk tailored to your organization. We would love to get the word out. We were super excited to get connected with this group and kind of start talking about things. So we're happy to do that. And then also what would be fantastic is if folks are willing, as we're kind of taking the next steps to build more robust trainings and not just this was a very, very broad overview, but we really want to build trainings that are specific and tailored to what social workers want and need. So we would love to have your input as well as we're trying to develop those. So that's the next 2 years of my life at minimum. My dissertation is kind of built around developing those trainings.
And I'm just curious for those on the call or now, what, I mean, it sounds like some of you are familiar and do use it. Is it, I mean, do you feel like these are things that, you know, could be used more in our practice, or do you feel like, I'm just curious kind of your overarching thoughts on it too. It sounds like some of you have experience with using these, but I'm just curious.
You know, I would say for us, you know, folks that we get even at hospice, and, you know, obviously we're already dealing with death and dying. So that's a complex issue with suicidal and homicidal ideation anyways. But it's certainly something that we've talked about using and writing affidavits. We've had some specific cases that have come up lately where this has been a really big learning opportunity, and being the experts in our area for those kinds of assessments, and figuring out how to connect people with those types of resources and how to keep people safe. It's definitely something that we're exploring more and utilizing.
Well, and we are happy to be a resource for you all. We'll send out, Kelsey's going to follow up with links to these resources and our information. And you can find us at the UW too, because we really want to increase kind of our collaboration with you all to really think about how we can best help people who are in crisis. And, you know, we want to be really cautious about, you know, using these, especially in Washington State, because as you know, we've talked a little bit about that, you know, law enforcement at this point are usually the ones filing. Sometimes it's family members. And so just, you know, there's a lot that we think about. And as Kelsey said, using that kind of more the holistic biopsychosocial approach that we, you know, love in social work and use, you know, in our practice, and just the clinical skills that you all have, and thinking about, there's a lot, you know, there's obviously a lot to think about when doing these interventions. So we're excited to talk with you, and just excited. Hopefully some of you will keep in contact with us or respond to Kelsey's survey, and we can develop some of these trainings together. And, you know, and someone asked, I wasn't sure who asked about, you know, policies in other states. And, you know, there's also opportunity to develop them in, you know, states that don't have them, but also in revising in Washington State or other states that do have them, because we want this to work for people, both providers and of course for people in the community who are really in crisis. So
Katie Davis, I'm so sorry.
Go ahead.
Katie Davis asks if it would be possible to also provide them with your presentation.
Yeah, definitely, absolutely.
And then I have another question. Let me scroll if I can find it again. Sorry, I got a lot of messages. I can't find who it was, but I think it was along the lines of trying to have those conversations with their clients. If you have any tips to be able to engage in those conversations.
Yeah, so definitely when we send out the links, the toolkit to that's tailored for health professionals does have some tips on how to do that. There is also a training done by Hopkins. I think it's still publicly available. It's unfortunately very tailored to physicians, but I think that some of their tips in terms of how to interact with clients might still be relevant. So I can also send that as well. And also just to circle back to what Megan was saying, she was talking about, opportunities to develop new laws in other states. But I also want to say that there are always opportunities to revise the laws here in Washington state. Last year, there was a law passed. I wish I could remember the number off the top of my head, but it was a kind of large scale revision of the civil order process. So domestic violence protection orders, stalking protection orders, basically all of the civil orders available, including IRPO. The process for filing was very confusing, both for family members who were filing, but it was also the kind of stipulations of who could have an IRPO or who could have a DVPO were not always clear for judges. And so sometimes we were seeing that judges didn't have the full comprehensive understanding of the intention behind the law and who was eligible for an IRPO. So we would see sometimes, oh, well, if someone has a DVPO, we're not going to file an IRPO for them. And so that was recently revised. It kind of overhauled the petitioning process to make it more accessible for folks. And we also had, I think it also included a revision of the language to shift things from things like kind of more pejorative language around dangerous mental illness to really focused on behaviors that are indicating risk.
I have another person asking about, there's a lot of discussion right now about firearms, but if you could speak a little bit more about other weapons that clients might purchase online, such as knives, various kinds of medications, things of that nature.
So that's not my area of expertise. I don't know if Megan, you have anything to add there. My research really is focused on firearms because they're the most lethal means, but those other weapons are obviously still, or even medications are obviously still a huge problem. Megan, do you have anything?
Yeah, and we've gotten asked that question in other presentations. We did actually, someone mentioned APS earlier. I think we did one to the state APS, workers around, and I think that same question got asked because it is a problem that we see. And these tools don't apply to other weapons or to pills or other lethal means that we talked about today. But I do think it's a great question, and in thinking about expansion or policies and interventions that we could think about for future. Certainly, there are places to get lock boxes and things like that, which you could put, which we recommend for medications and just in general to have those locked in the house for safety reasons. But there's no laws that or like as organized of policies as what we have for the firearms. But I think it's something we need to think about because and I wonder if the person who asked the question is it because it's probably more common. Those are more common. I would imagine things you see than firearm. I mean, firearms are common in Washington state actually, but in terms of your clients, is that would you all say that's true, or do you feel like it's a mix, or in terms of risk?
I'm getting a yes.
Yeah.
I have another question. Give me one moment. Let me scroll through and see if I can find it. I'm so sorry for being so slow with this.
You're doing great.
If you can speak a little bit more about the extreme risk protection orders and in regards to IRPO.
Anything more specifically about them?
Let me see if they wrote any. Let me scroll to the bottom. Yes. So from my understanding, please correct me if I'm wrong. In regards to filing the risk protection orders, is there anything special that they would have to do for the ERPO? Is it a separate document that they would have to file, or can they file it in conjunction? Is there anything like additional evidence that they would have to provide to show that ERPO is needed?
Okay, great. Yeah. So we'll also send a link out to the website that also kind of I gave a really brief overview. But in terms of what is included in the petition, whoever is completing the petition, in this case, it would have to be either a law enforcement officer or family member, would kind of describe what are the quote unquote dangerous behaviors and the circumstances that are leading to the need for an ERPO, and establishing really why the ERPO is needed. One thing that you all as clinicians can always do is submit an affidavit in addition to the petition. And I've seen a couple of those with ERPOs where folks are kind of outlining both the risk and the protective factor. So, these are the supports that my client has that means that the need for this order is probably temporary. It's not like a permanent long-term thing. They don't necessarily meet the criteria for other means of removal of firearms or removal of firearm rights, like involuntary hospital admission or being ITA'd, or something related to like domestic violence, which can also influence your ability to possess firearms. And so you can kind of outline both the kind of risk and protective factors that really give the judge what they need to understand this full picture of what's happening. Whereas what we see sometimes when just law enforcement is involved is they really just have access to such a limited set of information that sometimes the judge doesn't necessarily have the full context or have the full picture. And that can kind of, depending on things, make it more or less likely for an ERPO to be filed. So having that affidavit can be super helpful, especially from someone who has an established relationship with this person.
Thank you. Now I have a question. Sorry, everyone. I'm a little curious about if you have a template for the affidavit, and then because I think that would be really helpful and supportive to send out to our members.
Yeah, I don't know that exists, but we can definitely work with some of the ERPO advocates to see if we can develop something.
Thank you. I'm going to open it up back to the floor. If you want to message me your questions, or if you want to just unmute yourself, you're welcome to do so. In the chat box, I also have some links for you to complete. So the sign in, sign out form, we need that to verify that you attended today. And then also the evaluation form afterwards. If you could please complete both of those, that way we can ensure that we get you your CEUs. And I just really want to thank you, Kelsey and Megan, for today. I truly appreciate the both of you being willing to spend and share your time with us, and also all the wonderful knowledge that you have. I apologize for the confusion earlier when we first started. It seems that the wrong link was sent out. And so I emailed the correct link to all 32 people who had signed up and wanted to attend. And if you're okay with it, we'll talk afterwards to see if there's a way for us to be able to offer this training again. That way people who had wanted to attend can.
Absolutely. Yeah.
Absolutely.
Yeah. Let us know. We'd love to connect with all of you more. So thank you. Thanks for the invitation and for all your good questions and thoughts. We're really excited.
Well, if no one has any more questions, I hope all of you will have a wonderful rest of your day. And thank you so much for being here with us today.
Thank you.
Bye.
Bye.